First on 5, Mobile County is still listed in the high-risk category when it comes to spreading COVID-19.
WKRG News 5's Gabby Easterwood spoke with an official at Providence Hospital to discuss the latest changes to its visitation policy and how healthcare providers are being more careful as the Omicron variant spreads.
Omicron in Mobile, leaving hospitals having to find a solution.
It's in a delicate balance.
Last week, Providence changed their visitor policy to 1 visitor per day for non-COVID patients and 1 designated visitor for COVID patients for their entire hospitalization.
Really, the idea is to reduce the traffic. As we all know, crowding really causes more infections. And unfortunately, this time, the Omicron variant is very contagious.
This is all to combat Omicron, which is very contagious but has milder symptoms, leaving hospitalization numbers not a top concern. As of last week, 53 patients were hospitalized with COVID-19 at Providence, a number that grew by 11 from the week prior. But this is still significantly lower than when they hit their peak from the Delta surge last year on August 17th, when they hit 128 patients with COVID.
Patients have other illnesses, not just COVID. And we don't want people suffering from heart attacks and other types of problems and strokes. Those are still happening. We don't want to lose focus on those. So that's why we keep flexing our policies.
The transmissible variant also affecting their staffing.
A number of associates are infected, but fortunately, it is a short-lived illness.
They know the pandemic isn't over, but they are expecting a decline soon. In Mobile, Gabby Easterwood, WKRG News 5.
There were 500 new cases reported in Mobile County yesterday, all Omicron. The health department says numbers should drop now due to the Festival Center testing site closing due to a lack of tests. About 300 people were testing there each day. Also, the new free at-home tests from the federal government are not reportable. Hospitalizations will now become the county's new major indicator for COVID.